and thank you to all of our guests that are joining. We have an incredible topic today. I think it's dear to all of our hearts, especially what we've been through for the last year. So imagine if COVID-19 had struck in an IoMT connected world. And so just before we start, I just want to run through a couple of quick things. Obviously, let me just get this working. So just a quick introduction to those of you who don't know the Technology Collaboration Center. We sit in the intersection of innovation between 3 or 4 incredible industries in Houston: aerospace, energy, medicine, and academics. What we try and do is look for those crossover technologies to really benefit all industries as a whole. We are a member-driven organization, so I encourage you as not only individuals, but get your companies to become members. We have some great programs and services. Obviously, that was interrupted a little bit due to COVID, but I think come the Q4 of this year, we really are going to pick up again. Concierge collaboration services, which helps both startups with introductions to the large organizations, and then large organizations look for those incredibly innovative startups in our community. Seminars such as this, the TCC Live, and so forth. The workshops are really a great engagement initiative that we have. They're 2-3-day workshops, and we bring all professionals from a wide variety of industries to around certain topics, and they really are very good. And then organizations can post strategic challenges and get them involved with some of their most important initiatives. Next TCC Live in August. We're having a small break in July, but this one's great. VR, revolutionary approach to workplace well-being. We've got some great speakers there with Joe Waskow, Cindy Olsen, and astronaut Greg Chamatov. And it really is something, I think, coming out of COVID with some of the mental health issues that a lot of organizations are now dealing with their employees. It's going to be a great topic. Look forward to that. So just some housekeeping. If you can't hear us, which I hope you can, please turn up the volume on your computers. We have a Q&A. Please be very active in that. We might not be able to answer during the actual discussions, but we will certainly refer to them as we can, and then once the panel finishes. And then the chat window is always open as well. So chat amongst yourselves, chat with the host, chat with the panelists, and we look forward to the interaction. So we've got some great speakers today. Not only personal, well, I would say sort of friends over the years, because they were professional acquaintances as well. So Dr. Asif Ali is clinical professor at UT Health. I actually call him a doctorpreneur. He is very involved with a lot of the most innovative, I would sort of say, wearables and other sort of data connected startups. He has appeared on Dr. Oz. He's appeared on Fox and Friends. He has the largest cardiology practice, I believe, in Houston, where they do an incredible amount of clinical trials. Houston Cardiology Consultants, and just a great thinker, entrepreneur. Lisa Butcher leads EPAM's digital engagement. She's a trusted advisor to many of the biggest brands in the world across not only healthcare, life sciences, but also entertainment, oil and gas, and so forth. But really is a great thinker in terms of digital transformation, what we're seeing in a number of different industries. So just incredible speakers on this topic, and well-versed. And this is something that we chat about, outside of work, in fact. So without further ado, then, let me just jump straight into what we're going to try and achieve today. So I think, as we try and sort of answer this question, we're going to focus really on sort of 4 areas: diagnostics and testing, treatments and monitoring. Certainly, COVID was a huge accelerator in terms of remote telemedicine practice prevention, and then pandemic crisis population management. These are all very key. But within those, I think what we'll try and sort of look at is not only what's happened in the past, where we are today, and going forward, but what is our tech maturity at the moment and the current technology that might actually enable us sort of moving forward. and IoMT's role in that, and then some of the barriers that we are experiencing in terms of interoperability, which we won't dive into too much, but data privacy, artificial intelligence, and machine learning plays just such a huge part in terms of the amount of data that is now flowing into these systems, and how do we monitor that and make sense of that. And then something which is dear to certainly Lisa's heart, which is the human-centered design, and this is something really that speaks to how adoption really takes place, and then some critical factors moving forward with accelerating the IoMT world. So our panelists are well versed on all of these, but again, I'm going to leave a couple of slides up rather than our big faces, but these are the things that we're going to try and tackle. So I think rather than do any more formal introductions, we're going to dive straight in, but maybe at a 30,000 level to begin with, and just maybe ask you both what IoMT was a connected world means to both of you, Asif as a provider, and then Lisa as a digital engagement strategist. And I don't mind who goes first.
I don't mind kicking off, and then I'll pass to what I consider Dr. Ali as my rock star cardiologist, doctorpreneur as well. So I think at its core, I think just as a starting point, IoMT is a core part, obviously, of a connected health ecosystem, which unites people, processes, devices, and IT systems. But more pragmatically, the way I look at IoMT is that it's already having a dramatic impact on how we keep people safe and healthy. So that's obviously even more apparent as a result of COVID. Now, when you look at IoMT and then you look at the integration of some other emerging technologies is where I get really excited. That's where we look at the integration of 5G, AI, AR, machine learning, big data, blockchain. All of those just augment the power of IoMT. So expanding really the art of the possible of what we can do with IoMT. And it seems remiss if I mention anything around IoMT without talking about the power and the potential of the value of the data that's being collected, the vast amounts of data. Ultimately, I view IoMT as the gateway to collecting the valuable data, and then leveraging AI to develop insights that are actionable to help refine treatments and really pave the way for precision medicine and so many other benefits that I think we'll talk to throughout the course of this 45 minutes together. Dr. Ali.
All right, I'm super excited to have you on, Lisa, because I think it's a neat perspective to look at from software engineering and hardware to clinical applications. And thanks, Mark, for having me on. As a healthcare provider, the medical industry as a whole has been a slow adopter in regards to this whole digital vertical. We were really last to come on board digitizing even our medical records with EMR systems that don't really talk to each other, and they've been very compartmentalized. Last time I saw, there was over 600 EMRs in the United States, and as far as I know, they don't talk to each other. But with that said, COVID has actually become an accelerator for IoMT, and I think Lisa already kind of defined IoMT, Internet of Medical Things, and really to me that means how do we automate tasks that are commonly seen and done in medical profession. So that's accessing the healthcare, collection and analysis of data, feedback of the information to patients. And the goal is in efforts to really improve outcomes. And so we have to define what those outcomes are and what we're looking for. Tech-enabled healthcare, which is synonymous with the collective terms of telecare, telehealth, telemedicine, digital health, e-health. IoMT to me means taking that tech-enabled health, partnering patients and physicians in a digital connected healthcare system, knowing that we have to have an additional layer of HIPAA compliance, cybersecure data transmission, and adding to that devices like medical wearable devices at the end goal, again, collecting all of this data using AI and all of the great things that Lisa just talked about. But the question we have to ask ourselves is, how is all of that data and how is this connected IoMT world changing the management of the individual and changing the management of the population health to improve outcomes, with the goal of also driving healthcare costs down? And if you look at the American Society of Telemedicine and the American Medical Association, these are the three strategic focused areas in regards to telemedicine. That is improving access, that is collecting that data and improving outcomes with that data, and ultimately driving healthcare costs down. Those are the three initiatives. And so IoMT would be consistent with that, all in the same light of making it consumer friendly, medical provider friendly, high quality, and interoperable. All easy tasks, right, Mark and Lisa? And so the unprecedented events of COVID-19 has actually helped us accelerate this environment for IoMT to become reality in many ways, but we have a lot of work ahead of us to really make that a plausible solution for everyone.
No, I completely agree. And if that's the 30,000 foot view, yeah, I was thinking maybe space station view then. So yeah, I can't imagine how complicated it is on the ground view. Well, I can, but so I think then sort of moving a little bit into what you were saying there, Asif, in order to to really collect or be alerted or have an early warning sort of system, what are the types of data sets, I guess, that are required to be continuously monitored? And, do we actually have, was it the wearables and the sensors and systems in place now to collect those types of data sets that are going to be providing us that early warning system?
Lisa, I'll let you go again.
No problem. So I think to answer that question first, I think there's a few different areas that we wanted to touch on. Not only just population and prevention, but also diagnostics and treatment and monitoring. So I think, Dr. Ali, if it's okay with you, I'll put a few things out there, and then would love to also have you add in some experience that you have with some of the technologies today and how that's happening. And Mark, hopefully that answers your question. So I think, first of all, the rapid diagnostic ability of wearables combined with IoMT data is really where we're seeing effective healthcare delivery. And that's not just in times of pandemic, that's just in the course of prevention. There are some very exciting things that are happening now out there with existing IoMT devices, and so much in the works. So I don't think there's a day that goes by that I don't read an article about a new technology that's supporting finding ways to help prevent the next pandemic, or ways to improve the lives of others in those areas that we just talked about. So a couple different areas that I think are important to note, Mark, around your conversation around population health, is really the use of IoMT coupled with AI and ML for symptom detection. And how can we use things like intelligent sensors to help trace the origin of an outbreak and aggregated IoT data? So Dr. Ali, to kind of pass to you, because I know that there's so many examples already of how these devices are working in your practice. I'd love to hear from you, some of your thoughts.
Yeah, no, thanks, Lisa. And so when we're looking at remote monitoring and diagnostics from a pragmatic view, what's happening today, I mean, technologies exist today. In fact, we have diabetes prevention program, CCM, chronic care management, RPM, remote patient monitoring, that exists today to connect physician and patients in collecting data. I've given talks on this before, and I say that the future of medicine is where patients come to the office, and maybe now remotely, to really look at the data analytics, not just a one-time, every 3 months seeing the doctor, in some cases just once a year, but collecting data. And the office visit really should be all of the data that's being collected between the office visits. And what Mark was asking is, what are some of the critical data that's needed? And so when I, as a cardiologist, practicing cardiologist, and dealing with critical patients, I always look at it depends on what is the question that we're trying to answer, and what's the ongoing issue for that patient that we're trying to figure out. So from a high level, I always look at vitals, right? They're always important. Every patient that goes to an office visit, urgent care, hospital, ER, it always starts with vitals. We obtain blood pressure, pulse, status, and heart rate. So we have all of these parameters available today, depending on the patient ability to access these wearables. I'll give just some examples. For example, the Apple Watch provides pulse O2 sats and EKGs on demand. And there was a study actually done where predictive models based on O2 sats and pulse rate variability could help detect viruses like COVID-19. So, that's a practical application of a wearable that exists today. Other companies that I've dealt with, like Preventric, uses tonometry on the radial artery to provide accurate blood pressure readings. I'm sure you've seen ads on Freestyle Libre that detects blood sugars on the go. Zoll actually makes a device that measures fluid in your cavity chest in patients who are being monitored for heart failure, for example. So there are thousands of devices that exist today gathering what data that we need. I'll add one caveat, though, that we have to be really careful on the accuracy of that data. And we have to differentiate the consumer-based devices versus medical-grade devices. That line has been blurred. And I will state that no data is better than bad data. If we have bad data coming in, then we make decisions that can be erroneous and can actually be harmful to the patient. At the end of the day, when we collect all of this data, this remote monitoring and diagnostics, I think the last part of your question was, communication of that data. And to me, when I'm dealing with patients, communication is all about trust. Communication is about accuracy. Communication is about trust that good data is coming in and that we can make informed decisions for the patients. And I'll tell you that there was an article in 2019 in Medical Economics that asked patient consumers, how do you want to get this interaction of communication of your healthcare information and data? And overwhelmingly, the response was not phone calls, because as you know, Mark and Lisa, there's so many robocalls that come in, and you can't trust a phone number that you don't know. Emails get buried in spam and all sorts of places. But overwhelmingly, it was text messages that were highly curated that said, hey, in a patient, if you knew that text message was coming from, for example, my secretary, Connie, from Houston Cardiology Consultants, this is Dr. Ali, I need to set up an appointment to go over your last ultrasound of your heart. Well, you're going to be more adapt to answer that text message because it's a very highly curated text message. So, companies that I've worked with, like Curagram, have helped bridge and solve HIPAA compliant text messaging. And so I think it's so interesting in this IoMT, how many different aspects that we need to be able to cover in remote monitoring and diagnostics, and communicating effectively two-way, always remembering that the patient is the consumer, and how are we making that consumer-centric for that individual.
No, I completely agree. And I think, yeah, you're right. We've got all of these available devices. Now, whether all of us are wearing them or not, it is a question. And then the second part is, obviously these data flows are not going into the electronic medical records, and there's certainly not another layer that sits above that or below that then analyzes that data to look for trends or certain discrepancies. And so I think we'll touch upon maybe incentives a little bit later and what's going on with that. But given the amount of sensors and or wearables that we have in that data flow, obviously artificial intelligence and machine learning is going to play a huge role in, because you can't sit there, Dr. Asad, Alia, was it, and monitor every single one of your 6,000 patients, in real time. And so you need that layer of artificial intelligence to say, hey, something is happening here. And so the question then becomes, and we'll talk about this in terms of then it was information flow on a larger sort of scale. But if you're looking even in your practice, are there certain things that are happening, almost real time? You need to be alerted that these are happening, and then be obviously proactive in providing that. And I think maybe even Lisa, you can talk about that in terms of other sort of industries that you've sort of seen as well, how important artificial intelligence and certainly machine learning is going to be within that realm.
Yeah, absolutely. There's no doubt that across every single industry, the amount of data that we are collecting is immense. And in order to make it actionable across any industry, clearly AI is going to play a key role. And we're starting to see that come together, but we have a long way to go before we can realize it to its fullest extent, for sure.
That's right. Yeah, Dr. Ali, I mean, how many of your patients are wearing these devices that you regularly interact with or even see that data? You're on mute. Sorry.
So absolutely, thanks. Yeah, so real world experiences. Again, my office is a setting for a number of startups that beta tests devices, and as a practicing preventative cardiologist, I'm all about remote patient monitoring. I was an early adopter of diabetes prevention programs, chronic care management, remote patient monitoring. But when I look at the number of data flows that come in my practice, I'm astounded how many different and distinct flows there are to my day. And before this talk this morning, when I came in, I'm just going to give you a dizzying workflow of data that I literally have to deal with on a day-to-day basis. So I told you I use a company called Curegram that's HIPAA compliant text messaging for patients. So in the morning, I have to check messages streaming from last night and this morning to address any critical issues. Now, a lot of those text messaging may be billing questions, or maybe refill my medications, or maybe I need medical records, but those are, that's just data flow. Then I have real time data, and I counted, I have 7 vendors from everything from pacemaker information, AICDs, which are defibrillators, from 3 different companies in 3 different portals that need to be accessed on a daily basis. Next, I have emails from patients who send data like their Apple EKGs, their cardio with arrhythmia information. We have blood pressure data transmitted, everything from people writing it down on a scrap piece of paper, emailing us, texting us, or even Preventric, as I said, they have a device that measures blood pressures, and we have to print those out and look at the data analytics. I have 3 distinct vendors for Holter monitors, event monitors, and now even mobile continuous telemetry. For heart failure, I have Zoll, LifeVest, and HFAMs that provide all sorts of data on my heart failure patients, including the angle of their sleep, how many steps they've taken, their EKGs, their wearable times. I have reams of paper still on my desk from faxes, emails, and texts from other providers as a whole. And believe me, that none of this is interoperable. None of it is using blockchain technology, and none of my other providers can access that information. And
so you almost need another full-time job just analyzing the data rather than seeing the patients, which is the biggest issue, isn't it?
You're correct. And so we're trying to, in this IoMT world, reduce healthcare costs, but I can tell you the amount of data that's transmitted on a day-to-day basis is absolutely not doing that. And you're right, I've had to hire someone to help us shift through all of this, or look at technology solutions that will help us streamline the process. And I will point out one big project that occurred in the US that just got transacted this year that does a little bit of what we're talking about is the opioid crisis. Mm-hmm. So now, we can track patients and track physicians using a digital key. I had to register for a digital key and take some CME credits to be able to prescribe any type of class 3 agents. And that has become interoperable because all doctors and all systems can actually look at that. And that is just one example of the opioid crisis, which is a big issue that has occurred in the US. And how do we look at, parallels to do that with COVID? I think that, or the next pandemic, that's going to be, the big challenge for all of us.
So I think, yeah, and Lisa, you'll probably speak to this as well, is that getting started with something like, artificial intelligence, machine learning, that whole sort of digital transformation, now that the data is electronic. There was a time, not too many years ago, where most of your EMR was still, the electronic medical record was still sort of paper. And so I know that EPAN's been involved with a number of these digital transformation sort of initiatives, but really, how does, a large academic medical center, with these big EMR companies, was it the electronic medical record companies are no doubt sort of providing that a little bit of that sort of technology, but you've still got 99% of the rest of the United States, like Dr. Asif Ali is not part of a huge academic medical center. How does anybody start with that AI and ML, and is anybody sort of leading the charge to provide those sort of layers that you've sort of seen in the industry to help them?
Well, it takes tremendous collaboration, for one thing, across stakeholders in the organization to understand what the sources of data and how best to leverage and incorporate that data. So some are beginning to do that. You said something, Mark, that was interesting, though, that while there is all of this data that exists, because of interoperability issues, much of that electronic data is still being passed through very archaic means. As an example, for me, I use the Cardia mobile app, and although it's an incredibly powerful tool and collects great data, I literally have to print out the results of this and drive them to my cardiologist to be able to see the data. So I think, Dr. Ali, you mentioned a little bit earlier as well, that while you're looking at electronic data sources, that there still are some huge barriers in existing infrastructure and technology with providers that prevent the ability, to do this. So I think some of it is stakeholder collaboration, and it also requires incredible investment in technologies to be able to support this. So it's a combination. There's no magic bullet, unfortunately.
No, so I agree. And so let's just say we do solve, or certainly I think we've got the technology there, that layer of AI and through machine learning can sort of sit there and certainly be that early warning sort of system as it shifts through all the sort of data. But again, some of the biggest problems within healthcare at the moment is interoperability, and I think we could spend 4 hours speaking about the challenges of interoperability. But I think for the purpose of this, when we're talking about stakeholders from both from providers to government agencies and those that are dealing with potential pandemics, interoperability, just from a very high level, is a huge issue. So none of obviously Dr. Ali's electronic medical records or that real-time data is being accessed by the CDC or somebody else, and and so you've got all these silos of data that are occurring, maybe being analyzed, and no real sort of oversight of the whole sort of picture. Do you see what are some of the issues around maybe taking down some of these bottlenecks? I know privacy is one of them. We briefly touched about blockchain, and that's another whole sort of subject on its own right. But can we see a pathway through this interoperability where data can flow between these systems that might help?
Well, to me, for one thing, Mark, part of this is that IoMT devices need to be designed both for ease of adoption, but then also integrated with smart, validated analytics platforms. So again, coming back to the fact that needing to have the ability and the platforms to support AI and analytics is critical in order for that information to be leveraged in any meaningful way. So I would say that's one of the biggest barriers, and something that we certainly are helping companies move forward on that front. There's also so many, again, legacy systems that are involved. There's also just the need for systems to be up 24/7 in a hospital environment, which really makes it difficult to do upgrades and to be able to invest the time needed in the network to be able to facilitate this. So I think that's, again, one of the barriers that many are dealing with in the ecosystem. And clearly there's a need to continue to evolve the regulations to support true interoperability. We're making progress, obviously not completely there.
Yeah, Asif, I mean,
Yeah.
you see it on a daily basis, interoperability sort of issues, I guess, on that minutiae sort of scale, minute scale, but, on a sort of larger level there, the transfer of data and the flow of data, even if it's depersonalized or de-identified, that obviously is part of the key to providing an early warning pandemic system. Is that not true? Yeah.
Absolutely. So, I'll tell you, there's a philosophical umbrella over this whole discussion of interoperability. And that is, who owns the data? Whose rights when you're collecting data or giving data, who is responsible for that data? What are the privacy rights for that data? What are we signing off on? This is almost like a Black Mirror episode, right? Looking at big fish out there, big government, big healthcare systems. What we don't want in this whole interoperability, first of all, is dinging patients. For example, being discovered that you have a pre-existing condition and then having your insurance premiums go up. So I go back to what I was talking about before in communication. There's a level of trust, and that trust has to be very delineated to the individual. I always find it fascinating that in my career of medicine, you come to a doctor and you pay for services. But when it comes to getting your medical records, it's like an act of Congress to get them. Up until this year, there was a law passed that said you have the rights to your medical records. But until then, it's been amazing to me that you pay for your healthcare services, yet when you say, can I have a copy of my medical records? It's like, oh, we have to go through this department and you have to pay money in addition to get a copy of your medical records. Go to any hospital and you'll face the red tape. And so I've been battling this philosophical idea in this whole IoMT, which is the slippery slope is, philosophically, who owns the data? I believe that when we look at so many different portals and so many different systems, to me, when healthcare began, we created EMRs, should have been created on a basis with a platform where the EMRs could talk to each other and become interoperable. But we didn't do it that way. We did it in this country in a very consumer-centric methodology where, I think the dollars were put in front of what the intention was, which is driving healthcare costs down and helping that interoperability for patients and doctors and, the CDC to be able to manage these patients. My only solution that I can think of in the interim is to have the individual patient as the owner of their own data. That means if they go to 5 different doctors and 2 different hospitals and an urgent care and a freestanding ER, that all that data should be in a repository into their own phone, into their own system, and let them be the harbor of that information. And then incentivize them or gamify to allow that individual to share the data as it's needed. So in this pandemic, it could be things like your temperature. I mean, I don't think any individual wants to cause harm to themselves during this pandemic. They want to know, reliably how their health is and are they susceptible and what are their risks for contracting COVID. I mean, we know there, obesity, diabetes, hypertension, all these comorbid conditions increase their risk. But having an interoperable solution where you own your data, you have your, you have this, device that is so powerful now that can track and help individuals be the harbor of their own data and be able to explain and educate and make them aware of why we need that data in this population health and incentivize them and gamify the process will help just with the initial conversation of conversions and adoption of this whole ecosystem that we're trying to create. And I think that's where it begins. It begins with trust, education, awareness of the data, and have the individual being the harbor of that data, and have them be able to take in their own information, but be able to decide to delineate that information to other people as needed basis.
Yeah, who gets to decide? Yeah.
Dr. Ali, I don't know if you've noticed it in your practice, but there is a general trend, which is positive, that people are willing to share their data with their physician. I think where the reluctance comes, at least from what I understand, is really the drop off in the willingness to share with other stakeholders, whether it's your insurance company, pharmacies, your employers. And I'm curious if you see that in your practice, the willingness to want to share data with you, but a little bit more nervous about sharing that data with others.
Absolutely. And, that comes to 100%. So I would say there hasn't been a day that I haven't had someone come in with a wearable device and concerns about information about their pulse or heart or EKG or pulse oximeter. Right. This has become pop culture. This has become a norm. With Fitbit it came out. This, what's interesting, Lisa, is this was not driven by the healthcare industry. This was driven by the consumer. Consumers Absolutely. Were going out and getting devices to collect data on themselves because they were interested on, how am I doing? How many steps am I taking? How do I get healthier? And as the consumer started to collect their data, they started bringing that data over to the healthcare industry. And now all of a sudden, healthcare is like, oh, we should probably pay attention because you're exactly right, Lisa. It's become a norm where individuals are collecting their own data, but they want to curate that data and share it with only people that they trust. And that comes up with, the topic of we're talking about today is in a COVID-19 world. The question then is why did we not set up a parameter where physicians were much more involved, the healthcare industry much more involved in testing for COVID-19 tests? Because we were not given by the government in any of the offices that I know access to COVID testing way early back in March. This was, very regulated, which I understand, but to be able to get people tested was crazy. There were 4-hour, 5-hour lines and people driving up to tents when we already have an infrastructure of physicians and healthcare providers that could have tested and also given the vaccination, by the way. But you're right, it goes back to this trust level and who's looking at the data. And, most patients trust their physician because we're held to a very high level of standards where we have this overlying umbrella of HIPAA over us, and we can't just, willy-nilly discuss their personal healthcare issues without having consent from the patient. So I 100% agree with you. But philosophically, I think that's where we are with COVID-19.
I think you mentioned the value exchange as well. Sorry, Mark. And the value exchange for data. We know that consumers are much more willing to share that data if there's a value exchange. So maybe it used to be health and fitness and tracking that, but now the health and safety of their families and their loved ones in the time of COVID is hopefully, continues to be enough of a value exchange to really push that just a little bit further. And then I think, Mark, just one last thing I wanted to note is I think, we know that confidence in the security of the data is something that also needs to be in place for consumers to be able to share that data. So just again, to reiterate the fact that security as well as that value exchange is so critical in order for us to gain that trust.
No, that's right. And we're getting some really good. Was it chat? Was it on the chat function there? And it was as I knew, this should be a sort of a 2-day workshop rather than a 45-minute odd was the thing. But yeah, going back to what Asif said about that, I think the real accelerator is going to be the ownership of your own data, and then allowing access by different systems to that data, and that data can be de-identified. And certainly when it comes to things like temperature, blood pressure, maybe some other sort of key indicators, you don't mind sharing that de-identified data so that population health or people with who manage population health can have access to those data to see those early sort of outbreaks and various things like that. And I think Asif's right. I mean, everybody's monetizing data at the moment. Why can't you monetize your own healthcare data in a de-identified manner as well? So those are those sort of further incentives. So again, to keep this moving on, because I think we touch upon a little bit upon privacy there as well. But I think that there are systems in place now, or certainly coming to fruition, such as blockchain and things like that, which will de-identify data in a very good way. Much the same as I go to the grocery store at the moment. I go and pay for my groceries, and I swipe my card. All of a sudden, the grocery store, can certainly Visa and other intermediaries access to see if I've actually got the money to pay for those grocery stores and things like that. But there are ways that we can transfer this data in a meaningful way, as long as we own that data. So, while interoperability, certainly in the financial world and other sort of places, was accelerated by consumer sort of necessity, to make our lives easier. I think one thing that we discussed maybe the other day even was that most people hadn't come into contact with the healthcare industry prior to COVID, and they didn't know the inefficiencies and the frustrations of filling out 15,000 forms at 15 different doctors' offices. And so I think they've touched that now, and Lisa, you're so involved with an EPAM with human-centered design, and that I think once people understand the frustrations, and there's going to be a greater need to improve some of these systems, but it's all going to be based on this human-centered design concept. So maybe we can sort of talk about that just for a few minutes. I know that we're probably going to run over time, and I hope people stay with us. But I think this is a fascinating topic, and
I think we keep it. We can keep it brief.
and obviously, I'd just like to insert a really quick thing there, is that at the moment it's very much up. The onus is very much up to the individual to either buy an iWatch or the physician to prescribe a device. But with human-centered design at the foremost, are we going to see these sensors and systems embedded into sort of clothes, in your car, in items that are sort of almost ubiquitous to your daily life, that are going to be collecting that data and feeding it out, hopefully up to your personal own medical record? So
if that could also be a whole day topic. So I think, for one thing, we have to remember that patients and providers are consumers. We're all consumers. And when we look at our expectations, we will continue to voice our demands for personalization, for privacy, for convenience, and keeping that at the forefront of designing processes, devices, and systems is going to be critical to the success and the continued adoption of IoMT. I think, one of the differentiators of EPAM is that we take a human-centered approach to what is often considered a technology initiative. So, I think many try to solve this from a tech-first perspective, and taking a step back and really looking more holistically at the end-to-end journey, both from the aspect or the perspective of the patient, but also the providers, is really required in order to continue to expand adoption. So I think those are a few points that I would make. Dr. Ali, I don't know if you have any additional.
Yeah, I just wanted to add that when we're looking at the wearables and devices, the future and where we're going with human computing and better patient-centric models, we have to look at obtaining data passively. The issue of compliance and that is a big barrier to obtaining data. So as Mark was saying, the ability for us to create opportunities to collect data is paramount. I mean, I'll give you some examples. If you commute in a car, which a lot of us in Houston do, You could easily take a weight. You're putting on a seatbelt. You could, it's close to the heart. We could get information from there on your steering wheel. We can get pulse and oximeter. There's even toilets now that can look at. This is one for you, Mark, though. That can look at even things like changes in your urine, changes in your stool, and even detect cancers in some cases. So the more that we can passively help individuals collect their data without impeding and making them change their workday, is the day that we'll be able to obtain information where we can do the analytics, because we want to get data, but we don't want to have death by data. We want actionable data. And to be able to do that, we need to make it as easy as possible for the consumer to collect for us. And on top of that, if we can incentivize, we should reward people for sharing that data. For example, insurances, easily could say, hey, if you're doing so many steps, if you're losing weight, if you're able to, take pictures of your food. There was a startup I worked on called Fruitsery that you take pictures of your food and had a nutritionist help you with your meals and use a Fitbit and a weight scale to lower your weight. Well, if you join programs like that, then we should incentivize patients to say, hey, your insurance premiums will come down because you're interested and you're going to document the data for us. But the more passive that we can collect that data, incentivize patients, reward them, and then this whole concept of gamification, which many companies do very well, like my Starbucks this morning, that will absolutely help with adoption and conversion rates for us to meet this very euphoric idea of a IoMT world connected in this COVID-19 pandemic.
Yeah, I agree, and I think I'm just reading some of the chat, and it'd be interesting if you woke up every morning and you said, Jarvis, like Iron Man, how's everything looking, and and those readings are there, but I think also some of the other important issues that have been coming up there is around the sort of privacy issue, and I know that COVID vaccines have been was a huge sort of talking point at the moment, but at one point you sort of say, what kind of data can I sort of provide, de-identify for the greater good, so that these pockets of pandemics, of outbreaks are sort of more quickly sort of recognized and acted upon. And I think we could, I've certainly heard of some, initiatives where they obviously look at sewage systems, which I know is close to Lisa's heart, where they actually they can identify these things, from the sewage systems, not down to the very people, but certainly with these outbreaks and things like that. So I think we could go on for hours, and I know we're sort of running short, and so I think there's been a lot of talk and questions and answers certainly happening in the chat, which I'm going to try and get to, and I recommend that everybody reach out to Lisa, Asif, and myself, also if there are specific sort of areas or interests in initiatives. But I think to leave you with both one final question, and I'm sorry we couldn't go on, and I think in the fourth quarter maybe we do a 2-day workshop on this, but given what we've talked about, given where we are, and given what's happened with COVID, how far are we? How many years out are we to really having an IoMT sort of connected world? Do you think that that might actually really impact certainly some of the things that we saw this time around?
Let's pass it to Dr. Ali first.
So, I've been in the telemedicine world and wearable world for last 10 years, and I've consulted with major companies like Fitbit, and worked on some product with Cardia and other devices. And it's been such a huge issue just trying to get us past, for example, just using telemedicine. So if you look at a lot of the barriers, NASA actually started telemedicine back in the 1960s as a means to communicate for health of astronauts. So can you imagine, since 1960s, now we're sitting here in 2021 asking this question. So it means that the technology has existed, And now we have the broadband for, cloud computing and even quicker computing. So we actually have the technologies exist today to make that a reality. The barriers that have been in the past 10 years happen to be with Medicare rules of who can access this ability to obtain healthcare when and where patients wanted it. And part of that were parity laws that the parity means equal. So, being the healthcare actually providing healthcare to individuals remotely, there were a lot of stipulations. First, patients had to be at a medical designation, meaning a doctor's office, like in a rural area, to talk to a specialist. It could be for healthcare or specialization care, but it still meant that the patient had to travel to a medical destination. And then there were parity laws, and then there's also, we can't practice across state lines. So there was also just issues about, being able to take care of patients as they traveled in other states. And so COVID has been that accelerator to help us get past that. Medicare has accepted parity laws. Patients can do telemedicine, as you know, at their home. And so a lot of those barriers from the economics to where patients are located have been accomplished. But how close are we to actually having an ability where everything is speaking to each other? Patients are able to obtain data, do wearables, have the healthcare system and the government look at it, have green zones on like a Google map to say, hey, this is an area that's cleared, everyone's vaccinated, there's no temperature spikes, and with all the cybersecurity and blockchain and AI and everything that Lisa just talked about, we have a lot of work ahead of us. I think we've laid out a roadmap, and I think the technologies exist, but getting all of this working together is going to take companies like EPAM with all of its wonderful engineers to really figure out. And unfortunately, it really starts with where are the biggest healthcare costs. So we can look at congestive heart failure as the one of the number one costs to the country from patients have to be readmitted. And so I would say start with one area that we have a major problem with and find ways to solve that, and then use that as a pilot to help create solutions in other disparities like this COVID-19 pandemic.
So a long way off.
We're a ways off.
Mark, I like to say it's a journey, not a destination. The disruptor of COVID has been unbelievable, what we can do today that we couldn't do just a couple years ago. But that destination, I think, is going to be a moving target as these technologies evolve and as things evolve. You had asked me initially when I think we'd be there. And as I mentioned earlier, I'm one of those people who use my Cardia, and right now I'm printing things and sending to my cardiologist. But to me, we know we're there when something is triggered and I get a call that I have to have an appointment because something was found proactively. So very real use of that to change and improve a life, to me, is when we're there. And I feel like we're so close. We're so close, but it's a moving target.
I completely agree, and we're certainly going to hopefully be a lot better off than we were before. I think was it, the government has spent $16 trillion, I guess, on COVID so far. I know a lot of it is obviously not towards sort of future pandemics, but let's hope a few of those little billions have gone to maybe providing a better connected world. So again, I know we're running short. There's been some great questions. I hope Lisa and Asif, you've been seeing the chat. I'll certainly make those available. There was a couple of people asking for to be reached out. This was the purpose of these webinars, but I think more importantly, this has been the foundation to really doing maybe a very good workshop in the fourth quarter of this year, where we can tackle this over a real 2-day period with some experts in all different areas. And it's been fantastic. It's been a great format. I think it's a new format for the Collaboration Center, and I just want to thank you both and thank everybody who saw this. The recording will be available, and you can distribute it at will. It'll be on the Tech Collaboration website as well. So I'm not sure if there's anything else to say other than sorry to all the questions that were asked that we were not able to get to, and there were many and quite fascinating ones as well. But we'll do our best over the next couple of days to do that. So, any final remarks, Lisa or Asif? And
no, thank you for the opportunity. Certainly appreciate it. Look forward to responding to any questions that we had as well offline. So thank you.
it was really
Thank you
good.
to you
Thank
both.
you all.
Thank you
Really
very much.
appreciate it.